All right, can you hear me now?
I can hear you now. I can hear you. You
You can
live.
hear me?
Live. Yes, I can hear you.
Can you hear that?
Hmm. Want to play some music for a minute?
Can you hear that?
Yep.
And I wonder why I
It
can't
went away
hear.
now. I could hear it. I can't hear it now.
Oh no, I turned it off. Are you going live?
You are live, my friend.
Oh,
We only
I
had
didn't
till
even know I
six
was
ten,
live.
and I'm like, I just got back in the building. We only had till 6:10 to go live.
Oh, okay, okay. Yeah, I didn't even know we was live right now.
Yeah.
Let me change this real quick. Uh,
Yeah.
all
We'll
right,
give
it's
it about a
public.
minute or two for folks to join in. I'll check comments, see what people are. Yeah.
All right. Trying to get that light. I had to resort to my cell phone. I had to resort to my cell phone because my computer wanted to act up on me.
Yeah.
So I don't know if I got too much light in here or not.
Yeah. I can see ring lights in your glasses.
You can see three lights.
Yeah, in your glasses. But it's okay.
All right.
Hey, you got some
Well,
folks joining in. We're gonna get
all
these
right.
questions
Because I
going. If
got a
you got
lot of.
questions, put them in the chat. Put questions in the chat. Any questions, put them in the chat.
So you want to give people a few minutes to log in?
Yeah, but just talk to your folks while you wait for them to log in.
Well, I it's crazy, y'all. I mean, on the timeline, all you see is rest in peace and different things going on. And I'm just trying to bring some awareness. I asked Dr. Furr-Holden, would she come on so that because she's driven by numbers, and I didn't know that she had Michigan State up under me. I got I got distracted.
I got different background. What you want? What
No,
you
it's all
trying to
good.
do?
It's all good. I was just
What you
messing.
want to do, Art? What you want to do?
I was just messing. And,
No,
and, and,
no. All
and
right, I remember that for the future. I got you. I
no,
got
no, it's okay. It's okay. Um, I
you.
mean, all seriousness though, yeah. I'm sorry for that. It's just that I just wanted to bring Dr. Furr-Holden on again so that we can really emphasize on how important it is to know about the positivity rate, what the numbers are. Dr. Furr-Holden, she's the one that got the dashboard for Genesee County started. She know about the numbers. She's my expert. As far as when I need to know something, I go to Dr. Furr-Holden and ask her about it. But we really need to really take this serious because it's even though, and that's something that I was going to have her to speak on because we have so many different messages out here, and I know it's confusing to a lot of people because I myself sit back and I'm like, why are you saying this when this is going on? So it's confusing to a lot of people, especially people who are new to really looking at numbers and listening to the information. So it can be a bit confusing to everybody. So I asked Dr. Furr-Holden, will she come on again today at 6 so that we can have a frank discussion And please don't be afraid to ask any questions, because I know that there is a lot of questions out there, because I have a lot of questions, and I know everybody else have a lot of questions also. So with no further ado, Dr. Furr-Holden, you can take over.
All right. So whatever questions people have, whatever topics they want to discover, topics people want to discuss, I think we should do that, because as you know, we're in a surge right now. And it's funny because nationally, the rates were going down.
Yeah, but just talk to your folks while you wait for
even though the rates, I know, right? A little bit of feedback. Even though the rates were going down, they were still going up in Michigan.
I'm sorry.
I got you. And then with the rates going down nationally and going up in Michigan, then we got this new variant. We got the Omicron variant. And I call it the wildfire variant because it appears to spread like wildfire. And everybody wanted to do a big, happy, yay, this doesn't look that bad. It seems like it's just like a cold, etc. And then what are we finding out now? This virus spreads so easily and so many people are getting it, even people who are vaccinated. But what's crazy is that the vaccinated people, the numbers still hold up. 75 to 80% of the people who are in the hospital for COVID are still unvaccinated folks. And so I just want to talk about it and answer questions that people have, because I've been shocked at how many friends and family and loved ones have called me over the break between Christmas and New Year's. And even as early as today, I spent about 2 hours with my best girlfriend from high school today, talking about what should she do because of what happened in her dance studio. Somebody said somebody in their family was positive. Like, what do we do? I just know people have more questions than answers. So I hope we can get everybody's questions answered, because if people's experiences like mine, everybody, a lot of people right now in their personal life that have COVID or that just recently recovered. So we need to talk about why that is, what does that mean, and what can we do to keep people safe?
So here's a question that puzzles me, and I was thinking about it last night. I know they checked for certain strains to see which variant you have, right? Can a person?
Mostly not. No, most people will never know what strain of COVID they have. The testing is called genomic surveillance or genomic sequencing. You have to actually check the genetic footprint of the test, the positive test that you get from somebody, to find out what strain that person has. Most of us will never know what strain we have. What we've learned so far about how COVID works is the strains tend to become dominant. So there was a point when Delta was dominant. At some point, almost all of the cases that we saw in Michigan were Delta. So there was no need to, test to see which variant people had. Everybody that was COVID positive had Delta. We are dangerously close to getting to that same point with Omicron. But no, the majority, when I say the majority, I think about 99% or more of COVID positive cases will not have genomic sequencing done.
Okay, so my question is this, right? I know the people won't know, but the doctors, they check, or somebody check to see what type the person has, right?
No, they are two completely different processes. One process is to check to see, do you have COVID?
Right.
And there's two different tests for that. One is called the rapid test or the antigen test. That is testing for what is on the outside of the viral molecule. So the molecule is coronavirus. It looks like a crown. It's round. It's got little spikes coming off of it. On the antigen test, we're testing for the protein on the virus. We're testing for what's on the outside. That's the antigen test, the rapid test. The PCR test is testing for some of the substance on the inside of the virus, the actual virus itself. That is all a COVID test is doing, is testing to see if it's an antigen test, does it detect what's on the outside of the molecule? If If it's a PCR test, does it identify what's on the inside? It does not do anything to tell you which strain of COVID you have. In order to do that, what they do is they take the positive tests, and then whatever is left of the sample that you gave, if you did the swab and they did it in your nose, that then went in some liquid to stabilize it and make sure that other bacteria and viruses or whatever don't mess up the sample. Whatever is left from that sample, some percentage of those positive samples, the state will send off and do genomic sequencing on. And if you really do the math, right now it's about 1%. So only about 1% of COVID positive cases will we ever know which strain of COVID it was.
Right. So I understand that part, right? And I guess let me just get to the question that I was trying to get to on that part, right? Can a person catch Omicron and Delta at the same time? And do they check to see if an individual catches, or if an individual, just like you can have double pneumonia, right? Can you catch both viruses at the same time?
So, okay, there's a lot of questions in there. And mostly when people talk about double pneumonia, they talk about pneumonia in both lungs, not like two strains, but that's different. Because that's still your point that you're making is a good one. The short answer is we're not 100% sure. It looks like not, but we don't know 100%. The reason it looks like not is because the difference. Okay. My man Arthur just walked off on me, but that's okay. So when he comes back, I will answer the question of, can you get Delta and Omicron at the same time? And I'll go ahead and look at some of these questions in here. Somebody said, with Omicron, do you lose your taste and smell? A lot of individuals are feeling all symptoms, but the loss of taste and smell. Here's what we can say about that. Viruses have the potential to cause that symptom. We're not seeing a lot of reports of people losing taste and smell with Omicron, but it doesn't mean that you couldn't lose your taste and smell with Omicron. What I think is really great about this question, and Pam, thanks for asking it, is what are the symptoms? What are the things we need to look out for? The problem with Omicron is a lot of people don't even recognize the symptoms. I myself had COVID and I had Omicron. I Googled it, and then I called a friend of mine and said, hey, I got just this little teeny scratch in my throat. Art, you could at least go on mute, man. You're kind of distracted. You moving all around. We answering questions and trying to get this.
I'm sorry. I was looking for my bag so I can hook my speaker up, because I had to use my phone because my laptop wouldn't work. So I was looking for my bag so I could hook the speaker up. But I'm sorry, everybody. Yeah.
Okay. Thank you. Because we love you and you appreciate you bringing us together. We got you. Yeah. A lot of the symptoms seem to be evolving, and the symptoms seem to be a function of the strain. So as an example, earlier in the pandemic, we didn't hear about loss of taste and smell. That wasn't what we were talking about. We were talking about fever, chills, cough. As this virus has progressed, we're seeing the symptoms are also evolving. So you might not lose taste and smell. I didn't lose taste and smell. My symptoms were a scratchy throat that turned into a sore throat, a little bit of a cough at some point. I had a terrible headache in the beginning. And I had fatigue in the beginning, and that was fatigue with exhaustion. Some people might spike a fever. It might be a short-lived fever. You might have some activity in your nose, the runny nose or the stuffy nose, or both at the same time. That happened to me, but that didn't happen until about day 4 or day 5 after I got diagnosed. So just because you don't lose taste and smell, the short answer is it doesn't mean that you do not have COVID. And I think that also answers the question of what are the Omicron symptoms. The other thing I would add to that is to let people know, just because you might not have COVID, if you have symptoms, you got a runny nose, a cough, a fever, any of those type of symptoms, the same way no one wants your COVID, no one wants your cold either, or your flu. So if you have those kinds of symptoms, if you can, you should stay at home. If you have to be out, you should definitely mask. We should have been doing this independent of COVID. Because the same way, like I said, nobody wants your COVID. Nobody wants your cold either. So if you have any of those symptoms, I encourage people to stay home. Okay. All right. This kind of goes back, I think, Art, to also what you were talking about. She said, Danielle said, I recently tested positive, and it seems like I have a combination of symptoms for both variants. And the thing is, like I said, we can't box this thing in and pretend as if the symptoms that one person had will be exactly the symptoms that somebody else will have. The symptoms of Omicron do look to be a little bit different than what we saw with Delta, but potentially any one of those symptoms, somebody could have.
So Dr. Furr-Holden, the messaging is crazy from CDC and GHS, where they say that quarantine should be 5 days. Now, I understand what they're trying to do, because they are lacking in nursing and frontline workers, and they're trying to hurry up and rush them back. But how can you be asymptomatic and come back and just have on a mask? Why are they putting messaging out there like that is confusing to the people?
Yeah, I think unfortunately those recommendations are driven by politics and not science. We keep hearing our leaders say follow the science, but then that's not what they're doing. I think this idea that you could somehow 5 days after being exposed, or 5 days after testing positive, you can just if you don't have any symptoms, which I don't even know what that means. What does it mean if I don't have any symptoms? Because the symptoms persist. Even though my COVID resolved after about 2 weeks, I still dealt with, periodically, I noticed I'm more likely to lose my train of thought. I did notice a couple of times I was more tired. I was happy that the Christmas break came right afterwards, so I was able to kind of like spend more time in bed than normal. So what we call the symptoms for most people, are going to linger way more than 5 days. I think this new recommendation was more driven by the need to try to get healthcare workers back into the building than it was what the science tells us. There's nothing that tells us most people will still be shedding virus at 5 days. Even if you start to feel a little bit better, you still are at risk for infecting other people.
I mean, it's like, from the beginning to now, we have been getting so many different messages, and I can understand that confuses the people. At one point it was like, if you had the shot, you don't have to wear a mask, all these different things. So the message should be to the people, no matter if you had the shot or not, you can catch it. It's just not as severe.
Yeah.
Like my cousin who you were just talking to about lost the taste and smell, he had the shot and the booster, and he said it felt like somebody was sitting in his chest. Mm-hmm. So, but he didn't have to go to the hospital. So I know a lot of people feel like, man, if I get the shot, I'm still going to catch it. So would you elaborate on that, letting people know that if you get the shot, you still can catch it, and it's still, you're still going to have some symptoms, because the message at first was you can't catch it and this and this. So would you let them elaborate on that?
Yeah, it maps onto a great question that Dorian asked. And he said, was I vaccinated when I got COVID? If not, why? And if so, do I think my symptoms were less severe because of being vaxxed? So I'm going to answer them in rapid fire. Yes, I was vaccinated when I contracted COVID. I was vaccinated, but I was not boosted. I was actually scheduled to get my booster shot the Thursday after I contracted COVID. So I was fully vaxxed, but not boosted. And the event where I contracted COVID was on November 27th. And you say, if not, why? So I was vaccinated, and everybody knows I've been very honest and forthcoming about, my ideas and thoughts about the vaccine, mostly as a scientist and a public health professional, but sometimes personally, I was very hesitant in the beginning to get the vaccine. And then I had an opportunity to take it in January of this year. And I ended up taking some of those fears and hesitancies and concerns with me to get vaccinated. So I wasn't somebody that skipped down to get the shot in the arm. I was hesitant to go get the shot in the arm, but I did go get it. And I got both doses of the vaccine in January and in February. Do I think my symptoms were less severe because of being vaccinated? I can't say for certain. I feel like they were. What the science and what the data tell us is people who are vaccinated have much less severe symptoms. Those symptoms seem to persist less. They have a much lower likelihood of going into the hospital and a substantially less likelihood of dying. So I do think that being vaccinated had something to do with how severe my symptoms were, because we now know what the vaccine is good at is reducing the severity of symptoms, reducing the need for hospitalization, and reducing the risk of death. But like to Arthur's point, it doesn't make you bulletproof. It will not necessarily prevent you from contracting COVID. It won't prevent you from potentially becoming infected, but it will greatly reduce the chances that you'll become sick and die.
Now, I've been watching about the fourth booster shot, the third booster shot, Israel. I've been watching all that. Do you think that because they said that the Omicron was able to get around our immune system because it was in a person that had HIV and it took up some characteristics from that? I guess that's why I was asking, can you get both variants at the same time? And do you think that that Omicron can mutate to a stronger, more like Delta plus being more transmittable at the same time?
Well, so no, you would almost need a crystal ball to predict exactly what these mutations are going to look like. Here's what I'll say to people about that. All viruses mutate. That's not like a news flash. That's not something that we don't expect. We're learning about this virus. It's in a family of viruses that we're very familiar with, the family of coronaviruses. How this particular strain, SARS-CoV-2, the virus that causes the disease COVID-19, how it moves, how it mutates, what its natural course looks like, we're still figuring that out. So, and that's not a bad thing. This is new to the human population. So the good news is that the very basic prevention strategies that we keep talking about, they work. We know vaccines are the foundation of prevention of the spread of infectious disease. So people getting vaccinated, getting their booster. And I know it feels like we're a bit on an unending cycle of booster shots, and we've got a bunch of questions. Art, I don't know if you can see him because you had to join by phone, but I'll go ahead and
all right, yeah.
I'll pop up a couple questions. I want to make sure that people are honored and get their questions answered, because the whole point is it's for them.
Right. Do their questions. I'm good.
Yeah. So we'll do their questions, and you can interact with them too. And just thanks, folks, for bearing with us. We have technology breaks down, but Arthur Woodson is adamant. He wants to make sure his people have good information. But yeah, so we all just have to, my point is, be nimble and stay on our toes. The one thing I will say, and I have no problem venturing out on the skinny branches and saying things that might not be popular at the time, but I am pretty confident with this new, and I'm saying new, it's not really new. mRNA vaccine technology is not new in that it already existed. It was already under development. You talk to Dr. Kizzmekia Corbett, she'll tell you about all the great work they've been doing around mRNA vaccines. It greatly reduces the amount of time that it takes for us to identify the genetic profile of a virus and then produce a vaccine. We are really on the skinny branches and the brink of our second generation of COVID vaccines. And my hope is that those vaccines will be more specific to the strains of this coronavirus that we have with us right now that's wreaking so much havoc, right? It's the same thing with the flu vaccine. We didn't create a flu vaccine and then just keep giving people the same flu vaccine for eternity. The flu vaccine is different every year. It's built on, the strains that were available and known at the time, to build the best vaccine. So I am very hopeful about the second generation of COVID vaccines. But what the science tells us is getting vaccinated, getting boosted, wearing your mask. We now know you need not just the typical standard blue surgical mask that people have been wearing. You will likely need a mask that provides a little bit better protection, that's better fitted around the nose and the chin. The suggestion is a KN95 mask or an N95 mask. KN95 is, sufficient, because this particular strain of the virus is real sticky. It doesn't take very much for it to stick in your nose and your mouth and to replicate. Where before you needed a much higher sort of exposure for the virus to replicate and actually cause you to become infected. But the same things work. We just have to do them a little bit better. The vaccine still works. You just need a booster. The mask still works. You just need the best mask. And if you want to wear a cloth mask, put your surgical blue mask on underneath of it, so you at least have that second layer of protection. Anything for you, Art? Or you want me to just pull up some questions?
Oh no, just keep just answer that question.
Okay, so we got once somebody has been diagnosed, what's the best regimen for healing? When in isolation, how long is really necessary for isolation? And with all the variants, is it possible that I'm assuming the various means the variants get weaker? So once you've been diagnosed, the best regimen for healing is, I always tell people, listen to your body, number one, right? So I found that I was exhausted, and I was literally at the kitchen counter and washing dishes, and I got real tired, and my body just wanted me to lay down. And so I was like, oh, well, just lay down. Like, I got good rest. My throat was itchy, and I knew that at this point I was infected. So I was like, let me just keep flushing whatever's in my throat down to my gut, and warm liquids definitely soothe my throat. So I drank a lot of, warm liquids and tea. I didn't have a fever. If I had a fever, I would have probably used a fever reducer. So it's the same basic care that you would take if you had a cold, or a flu. And I really just encourage people, listen to your body. What's most important is that you do not infect other people. And really the only way to do that is in isolation, which is what this next question is. How long is it really necessary? And so the recommendation that I am still standing with is it's 14 days after exposure and 10 days after a positive test, or, you are a confirmed case. When we were earlier in the pandemic, the CDC said you cannot test out of isolation. That doesn't exactly make sense to me. It didn't make sense to me then. I know we now have a scarcity of testing. So if people's goal is to just test out of isolation, I would kind of say, well, just pause on that. If you can, take the 10 days after when you got diagnosed. Chances are many of us have run down during this pandemic, and that would be a relief for many people anyway. If you truly cannot afford to do that because you need to return to work, or just duties in life calls you and you've got to, get back sooner, then I do think it's important that people prioritize getting tested to make sure that they're negative, which would mean they don't have enough virus where they're shedding virus and potentially infecting other people. So that's my recommendation there. And is it possible that the variants will get weaker? Yeah, it's possible. And it's also possible that they'll just get different. Right? Not better or stronger, but they'll just be different, and we'll have to deal with different issues related to how to manage and mitigate this virus.
And Dr. Furr-Holden, the problem that I have is, and like I say, it's the mixed messaging that gets me, because, in the beginning, they said that the worst stage of the virus is between the 5th and the 7th day. So how can you come out of isolation on the 5th day when it's, they say the worst part of it is the 5th through the 7th day?
Yeah. No, I'm literally, and I'm not dogging my brothers at the and sisters at the CDC. And I know it's filled with smart people. It's just the messages that they're putting forward. They just feel very politically driven, not scientifically driven.
So that's what I really want to tell the people. You know, even though you heard from CDC, man. I mean, you know, I know you'll listen to CDC and all that, but at least stay in your house until the 7th day, so that you'll know that you're okay, so that you won't spread it to anybody else, man. Because we really need to get a handle on what's going on around us. You know, and that's the best way to help is to stay put and isolated until you get better. Because a lot of people running around, even though you have the vaccination shot and your symptoms are milder, you still can spread it. So it's good for you also, even if you had the vaccination shot, it's good that you isolate yourself also, because that is the main key to, you know, helping everybody around you. And we have to look out for each other. I mean, you know, that's the bottom line, is looking out for each other and wearing your mask. And that, you know, saying the mask, Dr. Furr-Holden, is my next question. I went online, and KN95s are $50 for 50 of them. People are running around right now. You know, Flint is hard hit. We have been in pandemics after pandemics. Where can we, the regular citizen, where can we find some KN95s or N95s?
Sure. So this is the request that we have made to our philanthropic community and to the city of Flint. So a lot of people might not have known this. You can get KN95s and have always, not always, but been able to get them for a mighty, mighty long time at the city of Flint. And how I know is I went to the city of Flint for a meeting, and someone handed me a mask, and it was a KN95 mask. This was about 4 months ago. So City Hall has them, and they're also ramping up on them. I think what we're going to do is we're going to increase the distribution of KN95 masks. So KN95 masks, as an example, are now the city of Flint Community Schools has them, and they have given them to the bus company. And I forgot what the number was, but I know it's more than a couple thousand a week that they give them to distribute to the school children, so that the school children aren't infecting each other on the bus, right? And they give them enough so that every kid on the bus gets a new mask every day. And so we'll have to just advertise where more of those sites are. But I do know that the health department in the city of Flint are both resources for those. At the testing sites, they used to give out the surgical mask. And I'm hoping that we can get that upgraded and that they'll be giving out the KN95 mask.
Okay. Is there any more questions before I?
Oh my gosh, there's so many. There's a lot of questions.
Okay, well, let me be quiet for a second.
There's a lot. I wish you could see them. If you were on your computer, you'd be able to see all the questions.
Let me see some. So if I give any feedback.
All right. So we got. Let me throw up a couple questions.
All right.
And if there's in particular you want to take, great. Okay. So we got. When should I get my vaccine after I test negative for COVID? Do you still have to wait 6 months from your last shot to get the booster? I can answer that one quickly. Yes. I can answer this one quickly. When should you get your vaccine after you test negative for COVID? Immediately. If you test negative, get vaccinated. Do you still have to wait 6 months? Yes, is the short answer. It looks like they're shortening that period for people who are immunocompromised or other things. But if you don't want to check the CDC, check the local Genesee County Health Department website. They have the criteria for boosters and shots and all of that there. And then my girl, Afina McKay, how soon should you get your booster after you recover from having COVID? Now, this is an interesting question. And should all symptoms be gone before the countdown? This recommendation is changing rapidly.
Yes.
It's changing rapidly. So I was scheduled to get my booster on Thursday, but contracted COVID on Saturday. And I started having my symptoms Monday night, Tuesday morning. And so like I wasn't going to get vaccinated with symptoms. So I believe the latest recommendation, I believe some people were saying you could get it right after. And I want to say the CDC says, but like they've just lost a lot of credibility. So 2 weeks. Some people say you can get it 2 weeks. Some people say you should wait 2 months, right? 8 weeks. So 2 weeks or 8 weeks. Somewhere in between there is what the recommendation is. After you have fully recovered. So you have 0 symptoms, or you've tested negative and have no symptoms, or you're like, 2 weeks to 8 weeks out from your infection. So the second part, should all the symptoms be gone before the countdown, before you go and get a booster? Absolutely. I would not recommend that people get the vaccine while they're symptomatic.
So what happened with me, you and I had a big thing about that one, right?
Yes.
I took the shot February the 15th of last year, and found out that I had I tested positive for COVID February the 25th. And that day I took, what was the name of it? The antibody infusion.
The monoclonal antibodies. You got
right.
it.
I took that February 25th. And they told me that I had so much antibody in my system that I had to wait 2 months, which I took May the 25th. I took the second dose, which was Pfizer.
Yeah.
I took that. So I don't know if that is beneficial or letting you in on something, but
but you had two things. You had infection, and then you also had a monoclonal antibody infusion, right? So you had antibodies injected into you, and you also had the newly forming antibodies from your vaccine. And then you got COVID all within like 1 week of each other, right? Within days of each other. All of that happened, right? So you're a little bit of an outlier. This is one of those things where I feel like this is why you need a good primary care physician, because you got to talk about this with your doctor. Like, real talk. You should not be getting advice from out there about, if I've had COVID and recovered, when is the best time for me to get the... Now, don't let the conversation with your doctor be a barrier. But if you don't have a doctor, get a doctor. In Flint and Genesee County, it's easy. You call the Genesee Health Plan. They'll help you with insurance. You call our federally qualified health center. We got a couple of them. Hamilton Community Health Network is one of them. They will get you set up with a primary care physician. All of that. You got to have these conversations with your primary care provider. I personally, and I'll just be honest, have decided I am not getting a booster. Right now, I'm going to wait 8 weeks. And that's my personal preference. This is not Dr. Deb. This is like a real, just Deborah, like India's grandma, Jordan, Gabe, and Olivia's mom. I'm like, having contracted COVID, had symptoms. They weren't terrible. I recovered from it. I thought, man, the thought of exciting my immune system up even more when I had the strain that I know is the one that's dominant now. And I know I probably got about at least 8, if not more like 12 to 16 weeks of protection from my own infection. I thought, let me just hold out and see if a better booster or a better vaccine, comes out that's more specific to what's out right now and what strains are out right now.
Danielle Price, I got my infusion at the VA Ann Arbor. They told me the thing about getting an infusion, you would have to get it as soon as you have the symptoms and something to that effect. You have to get it right away. It can't be where you it's 5 to 7 days down the road. You have to have it right then and there. So the day that I found out, as soon as I found out, like 1 o'clock that afternoon, I was back down at the VA at 6 o'clock that evening getting an infusion.
Yeah. So this to follow up on something that was asked. Pam said I had the Johnson & Johnson. They informed me that I can receive my booster of either vaccine in 2 months. This is true, but notice when you say either vaccine, you're talking about the Pfizer or the Moderna vaccine. I don't even think we're administering new shots of Johnson & Johnson right now. And once you are vaccinated with the Pfizer and Moderna, if you're newly vaccinated, the booster is 6 months. It can be shorter, 4 to 5 months for people who, like I said, fall in this special category, immunocompromised or pre-existing condition, chronic condition, etc. So yeah, those recommendations say the same. It looks like with J&J, if they do continue to administer it, I don't know why it would be called a booster if you got to get one shot and then you got to get the booster within 6 to 8 weeks later. To me, that's just a 2-shot vaccine. But that's what it looks like. If J&J does stick around, it is going to end up being a 2-shot vaccine.
No, that's my cousin right there. She just had it about 2-3 weeks ago.
Mm-hmm.
And I guess my thing here, my question, and a lot of people are asking, can you overbuild? Can you build your immune system and antibodies? Can you do it too much? Can you put too much in there? I mean, you understand the question I'm asking?
No, I do. And the short answer is yes. You can do the most with your immune system. And that's why we don't want people getting vaccinated if they know they're COVID positive, right? Because your immune system's already kicked in. It's already, fighting. You don't want to put it in overdrive mode and like that. So that in fact is true. And I think that's why we're continuing to do what's called the clinical trials research on vaccines and boosters to be able to understand how much is too much or how little is too little. The goal is to give people enough that will give them protection, but not so much that you put them in harm's way. And we are still figuring that out. And like I said, do not be surprised, mark my words, 2nd generation vaccines are coming out and we're going to end up what we call a booster right now. I don't know what it's going to be called long term, but I'm envisioning that this is going to look something like flu. You're going to get, it's going to be more seasonal. And you're going to get your annual shot. And it might be something that's like an annual shot and potentially a booster for people who might be in a high risk category. That's what I think this is going to look like long term.
So, oh, and Miss Vincent put something up on there that I mean, as soon as I asked or said that, she put it up as soon as I said it too. Israeli scientists. She put Israeli scientists warn of immune system fatigue. Mm-hmm. You see that one, that comment?
Yes, gotcha.
Yeah. So she said Israeli scientists warn of immune system fatigue from too much vaccine, which could harm the body's ability to fight COVID. Of course, this was said in response to a possible 4th dose. I like that you question the plan.
Yes. The answer can't just be infinite booster shots. I mean, like I am with you on that. That's why I'm like literally talking when they talk about the J&J and they're like, yeah, you get your shot and then you get your booster like 8 weeks later. I'm like, is that a booster? 2 months like, this is the 2nd shot, right?
Hey, I mean, you try to, it's like you can't overdo stuff.
And encourage people to get vaccinated and all that, but I also have to be honest and true to myself and use my own logic,
right?
So yes, so this is and I like it, Joyce. Joyce raised a good one.
Hey, I ate the wrong cabbage. Oh, go get a booster shot.
Right.
Hey. Every time you turn around, they're gonna be saying, "Go get a booster shot." Hey, I got indigestion. Go get a booster shot.
And then watch, eventually they won't be free either.
Right. Oh, see, now I ain't laughing at that one. I'm not laughing at that
that's
one.
real. Eventually they won't be free. So
No,
I'm
not gonna laugh at that one, Dr. Furr-Holden. Yeah. Because I mean, you making it sound like they transitioning from a crisis, a pandemic, to a money making scheme here. So I'm gonna try to leave that one alone for right now.
Yeah.
But here's a question for you. Here's a question, and this is a serious question, and it's not about it's about race and classism.
Yeah.
All right. When the virus first came, it was a lot of racial disparities. Mm-hmm. A lot of people from Flint and classism at the same time was sent home and said, if your symptoms get worse, please come back to the hospital. Yeah. Well, they got sent home and they couldn't make it back to the hospital because their body either had that what is that, cryotine crash or
cytokine storm.
Oh, all right. I knew it was something.
Yeah.
I knew it was something, but it's not.
Yeah, I got you.
You know, they either that happened, or and that's why I asked about the immune system and antibodies and everything, because of that right there. And could you explain to the people what that is?
Oh, when you have the cytokine storm?
Yeah.
Well, and I'm gonna give y'all the real lay example, because I'm not a physician, right? I don't treat people. I try to, treat whole communities, right? Like help solve problems at the community level. But the short version is you get this immune response and your immune system gets activated and it's fighting really hard, but it's not winning. And so it kicks into super high gear. And then the body actually starts to attack itself. Your body starts to create an immune response that starts to attack even your own organs. And that's because the immune system gets overexcited and just gets out of whack. And so we do want to avoid that with people. And this is the one good thing we've learned about COVID during this pandemic, is we have much better treatment for COVID patients in the hospital. That's a reason why we have so many more cases right now. Also, it contributes. We have so many more cases, but a lot fewer people are dying. We now know better how to treat COVID patients than we did when this pandemic started. But yes, it is very possible to overexcite your immune system and to have the unintended consequences of things getting worse instead of getting better. And sometimes they get worse to the point where it causes death. So yes, that's real.
So now that leads me back to the hospitals turning people away or telling them to go home. And if their symptoms get worse, come back, but they can't make it back to the hospital. And when we first seen this happen, it was mainly people from the city of Flint that was being turned away, because one of the union bosses, president, was one of the people that happened to. What has the governor or Genesee County Health Department, what have they done to help us as far as fixing that or getting people in? Because what I'm hearing, is some things that isn't pleasant, but I can't say anything about it right now. But what is it that the governor or someone can do to get these hospitals to stop doing or stop trying to make a dollar and help the people and save lives?
Yeah, I think the issue is bigger, honestly, Arthur, even than a state or a governor. Your point is well received, which is and I'm gonna just tell you the real question. I think it's not the question you're asking. The one I think you should be asking is, how is it that we don't have a standard of care or any rules around what to do when resources become scarce and care providers and hospitals have to make tough decisions around who gets what, who gets the life-saving care, who gets the last ventilator, who gets admitted, who has to sit in the wait room, who gets triaged to come back, who is recommended to go back home. Like there, but I don't even know if, I mean, a state could do it. A state could do it. But it's something where we need good laws and policies around it. Physicians and healthcare professionals have to be trained in it. There has to be some accountability system around it. Like the thing you're talking about, I respect and appreciate it. It's needed, but it's so much. It's so much more than just what the state needs to be doing. It's a transformation of our healthcare system, and the legislation needs to be national and in effect in all 50 states.
So let me ask you this, right? When this happened back in 2020, we didn't had over a whole year, and the governor put together this racial disparity task force. Yeah. Whatever become of that? I mean, what happened with that? And I mean, what came out of that?
Say that I was making a mistake of trying to read a question and listen to you.
The racial disparity task force that the governor put together right after all this had happened. Yeah. Whatever came out of that? I mean, what did we learn from her racial disparity task force?
Yeah, so I'm on that task force.
Okay. I didn't know you was on there, but all right. So now we can really find out.
Guess what? You can still come for the task force, still ask the questions. Like you don't even have to be, respectability politics will get us nowhere. So these are good questions. Here's what I can say. Michigan was the third state to come forward with its racial disparities in COVID cases and deaths. Our numbers at the time, African Americans, about 14% of the population, but 41% of COVID deaths, made no sense whatsoever. 3 times overrepresented. Right before us, Illinois came out and they highlighted some big things in Chicago. Louisiana came out, highlighted big disparities they saw in New Orleans, just as an example. And then most people kind of marched on. We did create a task force that did actually do the work to address the disparities that we saw in Michigan and to deal with some of the not full-blown root causes, but like the things that were beyond the individual. So what we found out is, for example, a lot of Black folks were contracting COVID more so than their white neighbors because they were forced to go out to work. They didn't have the kind of jobs where you could just convert it over to Zoom and sit at home and do it all on Zoom and still collect a paycheck. People had to go out and earn a living and things like that. We created this new thing called essential workers. But never before the pandemic did we consider the person who works at Meijer or Walmart an essential worker. But we not only changed how we view them, we gave them a name that seemed to carry some importance. But before that, we didn't do that. And we know now that a lot of what we saw with more deaths, it was originally people talked a lot about pre-existing health conditions, but that only accounted for about 10-15% of the difference we saw. It was all these other things, and the fact that if you were Black, you were much more likely to become a COVID case because you were much more likely to be moving and out and about by force, not even really by choice because you had to eat. You know what I'm saying? Than like some of your other counterparts. So in Michigan, we dealt with some of those issues. We did close the Black-white disparity. We have not closed the Hispanic disparity nor the Native American disparity. Some of the issues there are a little bit different. But the problem is, as you know, there's so much missing data. Nobody can even say with certainty how much of that gap is closed and if it's closed even at all still.
Because I looked at that dashboard and we're going to have a conversation about that dashboard. And
I'm shaking your finger at me. You just shook your finger at me.
So Jamaica Thorne said, isn't it true that if you have contracted COVID-19 and you are healed, oh, you can read it because you need to answer that question.
Okay. And your body has created the antigens, then it's best not to get the vaccine because it would create a war inside your body, so to speak. That's both got an air of truth to it, a lot of truth to it, and it's also got more nuance to it. So in fact, that's why, the recommendation for initial doses was you needed to be 2 weeks after you recovered from COVID. And then that's a little bit different from the recommendation to get a booster. But like I said, even the booster recommendation is changing. This is why, again, I think you just have to talk about that with your doctor and figure out what really makes sense to you. I would think of the recommendations this way. It's not the formula. It's not that you have to do it this way. Sometimes the recommendations and the regulations actually will dictate how soon you can get something. There were people, I literally only became booster eligible about 10 days before I contracted COVID. So I made an appointment, and if in hindsight, I wasn't thinking about when I was traveling and, all that stuff, or maybe I would have got it before I traveled, but it was only, not that far before I traveled that I even became booster eligible. Just because you're eligible, if you have questions or doubts, talk about it with your healthcare provider, whether it be your primary healthcare physician, your nurse. A lot of us got medical people in our family. Like, talk about it and make a decision that really makes sense for you. I wouldn't just categorically not get it for fear of harming your immune system, but you don't also have to immediately just go with the recommendation if it doesn't make sense to you. Because I do believe right now they're saying it at 2 weeks after is like the CDC recommendation and maybe even our local health department recommendation. I personally said I was going to wait 8 weeks, and I also wanted to see if any other, more specific vaccines would be available. So that if I was getting boosted, I would be getting boosted for something that's more of a match for what's out here right now.
You want to answer some more questions real quick?
Yeah, let's just try to get a couple more on so we can stay under an hour. I think we got about 3-4 more minutes left.
Right.
What damage does COVID have if you get COVID more than once? The receptors COVID binds to are all throughout your body. They're called ACE2 receptors. The more opportunity this virus has to bind, the more damage it does. For some people, it really wreaks havoc. For most people, I think their second infection was worse than their first infection. That's not a rule, but what it does say is it doesn't follow what we would hope, which is that if you've ever been infected, body will have a better chance of fighting it off. Think about it as chickenpox and shingles. In order for you to get shingles, the virus that causes it is already inside of you, right? You got that when you got chickenpox. And shingles is rough, I've heard. It's really rough. So, a reinfection, it could be substantially worse than an initial infection, and definitely the combined effect of 2 infections being way worse than one is. I hope that was helpful. Oh, this is hey, good evening, Glenda Lindsay. Do you think testing is used in place of the vaccine or booster shots? Some schools, including my university, are saying now you have to be tested as negative before you come back to work. So some people will have to take it as if I get a negative test in January. I don't have to worry about it for the rest of the semester. I'm good. The email doesn't say anything about constant testing in spite of the vaccine. The test is only as good as good up to that basically moment when you took it, and it's only going to tell you about from that moment that you took it. If you're talking about a rapid test, it's going to basically tell you about 3-4 days before when you took it if you were COVID negative or not. Like, it's just not, they're not perfect. They're not, but that said, if you want to re-engage, reopen, and, help to minimize spread, you're going to need more robust testing than one and done. There's no way getting tested and testing negative by January 1 is going to provide anything to the university, literally even by like January 10th, let alone by April 10th or May 5th, or, you know.
I mean, it would probably be okay if everybody was in the bubble. You know, if
Yeah.
everybody was in the bubble and no one leaves and no one gets to come in, and everybody takes that test right then and there, and no one leaves or come in, then it would probably be okay. But you know, you got to go out and you got to be around people. It's people coming around you that might be positive. So that test, I mean, you can test today. I saw where somebody had put on here that what was it? They tested where was it? I know someone that got tested on 12/30 and was negative, then tested on January the 1st because they were exposed and was positive. And then now on 1/9 tested negative, but they are still showing symptoms. Is that normal? That was one of the questions. So that goes to where you can test negative today, be exposed to somebody tomorrow, and you know, test positive.
Yeah, I was looking for the question, but you can. Oh, there it is. There it is. There it is. I see it. There, and the short answer is this. And then I'm curious what kind of test it was.
Right.
So they tested negative. 12/30 was negative. All right, 12/1, they were positive. Okay, that's 2 days later, they were positive. Now on 1/9, they're negative. That means they've cleared the virus, but they're still showing symptoms. You can clear the virus, but you now got to live with the impacts. So it's like if somebody break into your house and they take a baseball bat and they smash up all your stuff. Well, the time that they're in there smashing your stuff, you know, you can hear the glass breaking, you can blah, blah, blah. Well, once you clear them criminals out, there's then all the damage that's left in your place. And it's going to take you days to clean all that stuff up, maybe weeks. Your body is the same way. Our cellular process of restoring ourselves and restoring our cells does not happen in a day. Even though cells are turning over, you need all the cells and multiple cells and systems to turn over. And so you will be potentially, you know, different people's bodies, you know, vary in how well they are able to recover. And this is what we talk about. We talk about recovering from COVID. And some people tend to do it very quickly and pretty well. I know somebody who on their first COVID infection that happened. And then when they got infected the second time, it knocked them down and they had the lingering low-grade symptoms for months. I know people who lost taste and smell and didn't get that back for months. There are some people who still don't have it back and some people who might indefinitely not get it back.
So Dr. Furr-Holden, and I know we have to go, but here's a question, right? Mental health crisis behind this right now. All right. And the COVID takes the oxygen levels real low, correct?
Yep.
The brain need oxygen. The brain need oxygen. Do you think this pandemic has something to do with a lot of mental illnesses and a lot of mental different things going on, mental health crisis? Do you think that this COVID, by the oxygen being low and us having to wear masks, do you think that can play a role in this?
Well, I mean, I think all of it can, but also to add to the things you already said, you know, just this living under the stress of the conditions that people have to live in, not because, you know, some of it feels like first world problems, but, you know, being socially isolated, not having holidays, you know what I mean? People now have had, you know, loved ones die. They had to do the funeral on Zoom. Normally you do Christmas at auntie so-and-so, grandma so-and-so house, and you can't do that, or people did it. And then a lot of people got sick from it. And then you gotta, I mean, there's just a lot that's happening. Some of it is biological, because I know they call it COVID brain or brain fog, like COVID related brain fog, where people talk about after they recover, just not like your pistons not firing the same way they did before, not having that same mental acuity, that same, losing your train of thought real easy, the word,
So
not
what do
being able
you?
to get the word to come to you.
So what is it that we need to do on that part also? I mean, we talking about the vaccines, we talking about, washing the hands and wearing the mask and being careful and all that. What part do we bring in as far as helping on the mental health part?
Well, there's a couple things. Some of the things you pointed to are important, and they are biological. And so we need to continue to do the work to make sure that we can treat the most sickest among us and have great therapeutics that have been tried and tested, right? Nobody wants your loved one to be the experimental guinea pig when they're fighting for their life, right?
Right.
So we got to continue to do that work and have good therapeutics, because things that tend to have a biological origin sometimes also will have a biological solution, right? So there's that. And then I think we have to acknowledge the real mental toll that this takes on people and do what we can on the other end of the spectrum, which is prevention. How do we prevent it in the first place? And again, you've got these same receptors in your brain that this, disease, that this virus, binds to. So we need to prevent people from contracting this thing in the first place. And if they do, give them every opportunity that they can have to fight it off and do well. People just don't get it. When you talk to people who have struggled with COVID and people who are dealing with long COVID, that means they have symptoms that they have gone, and I forgot the exact definition. I think it's that have persisted for more than, it's either like 4 months or 6 months after you recovered. There's so many people with long COVID, and they say it's terrible. It's terrible. And they regret. They're like, had no idea. And it doesn't make sense. Sometimes it's families, and they're like, I'm younger and healthier than my cousin who got it, who has no problems, and I now am on dialysis. I now have vision problems. I now have hearing problems, or, people are having all kinds of long-term, things that are coming from this. Yeah.
So last question for me, and
Okay.
I know you have to get off, but I just want the people to know that we coming on to just try to make people aware that this is serious. And, it's not about politics. It's not about trying to force you to do anything that you don't want to do. I'm not here to try to persuade you, trick you, or do any of the sort. This is about just trying to put information out there. Either you accept it or you don't. That's just the bottom line. It's not here to debate with you. It's not here. My research has given me this, and my research has given me that. This is just what I have seen, the people around me, all three of my grandkids have COVID right now. One is 8 months, one is 4, and one is 14. I don't have time to play politics and debate. My cousin had it. My friend is in ICU right now. I know of people who have died from it. So when it comes to trying to figure out what's best to keep us alive, I don't have time to debate with you and argue with you over different things, because I know it's one thing for sure. Either you can take this vaccine now, or you can wait until you in the emergency room and they start pumping emergency drugs in you that you don't know anything about. And then if you haven't never been to a church before, it will be your first time going by yourself. You will die by yourself because can't nobody see you. They will not let anybody in the hospital to see you. So this isn't about debating. This isn't about, who research is the best and what green bottles and green seaweed and sea moss you can put together. It's just trying to come up with solutions to try to help people survive. That's it. And Dr. Furr-Holden, my last question to you, being that my grandson is 8 months, he had a temperature of 104. To all the parents that would think that, oh, it's just a cold, it's just a fever, should they, say, you know what, I'm just going to take precaution and I'm just going to take my son or my daughter to the hospital anyway? Or should they try to wait it out? What do you think they should do when that occurs?
Well, the hospitals are overrun right now. I'm going to tell people that right now. Testing is getting stressed out and stretched out. The best thing you can do is prevention and prevent exposure in the first place, or just reduce and do your best to mitigate risk of exposure. If you have someone, and likely if you have a child with COVID symptoms in a household, chances are that child either got it from an adult or they've infected the adults. So get tested, and like I said, testing is not quite as easy breezy as it was before, because now there's so many people getting tested. We've added a little bit of strain, so it might take you a little bit longer to get a test, right? You might have to stand in line a little bit longer. I've heard stories about the cars wrapped around the building for the drive-up testing and all of that. So, just plan accordingly. The best thing is prevention. I would encourage people to get tested, not to go to the hospital. You want to get tested first. And then, same protocols you followed before. If your child spikes a fever, 104 fever is a hospital fee. That's high enough where you would take your child to, to the hospital. But you've got to be prepared for long waits. You've really, I can't stress this on people enough. My daughter went to the emergency department. She was traumatized from that experience. And I just wouldn't wish that on anybody. The goal is to keep people out of the emergency department. Why? So that the people who really need it don't have to wait. People are dying in the emergency department waiting room with cardiac conditions where they could have been brought back, and had a different outcome. People are suffering. They're in pain. And you can't give somebody pain medicine while they're in the waiting room. They can't get pain medicine after seeing the triage nurse. They got to see the physician, the attending on staff, or the resident, or whoever is the one with the MD has to see them and write that script before they can get a pain medicine. So a lot of our loved ones are sitting in the ED in pain with a broken leg or a broken arm or a laceration, or they were in a car crash. This is not the time for people to be in the emergency department and in the hospital. We need those seats reserved for the people who really, really need them, not for people with preventable illness.
And I want to say this also, everybody. We can't be mad at the nurses, all right? I mean, the nurses this is going on, 3 years now? And they have been continuously seeing, patients, continuously. They haven't had a break. And can you imagine seeing somebody, seeing people, and your main reason for going to school to be a nurse is to help save lives, and the emergency rooms are so packed that they doing crisis standard to where they picking and choosing who it is that dies. Okay, we can't save this person over here, so this person gonna have to die. We can save this one over here. This is what is basically almost going on right now, is what they call crisis standard. And if we don't do something right now, as far as lessening or fixing that curve, then we are in trouble. They're gonna pick and choose who it is that they let live. And do you want to put yourself in a position to where I'm going to let this person live right here because they stand a better chance at surviving. Or maybe they don't even maybe they stand a chance at surviving, but I just don't want them to live. Why you want to put your life like that in somebody else's hands? So I'm just asking. I'm doing everything humanly possible to get you to understand. If you don't want to take the vaccination, okay, cool, fine, and dandy. But at least wear a mask, wash your hands, do safe distancing, do something to be preventable, to where you don't catch it or spread it. At least participate in doing something. Just don't sit back and talk about it. Do something, y'all, so that we can help the people who have a broken arm, who has a bad heart, who has diabetes, who's going in there for high sugar. Other than COVID, we should try to free up space for those individuals and not be selfish because we are worried about our freedom of not being able to wear a mask. I'm going to show you that I have my freedom and I'm not going to wear a mask. I'm going to show you that this and this and this. This, y'all, right now is not political. This is all about helping each other so that we can maintain our lives and help our brothers and sisters, our neighbors, our mother, father, brother, sister, aunt, uncle, cousins, nephew, nieces, whoever. I'm serious, y'all. I'm done now. I'm sorry.
All right. Tell your people thank you. I say thank you to folks for being willing to listen. I'm always willing to bring forward whatever knowledge, insight, information. I've had my own personal experience. I've shared my heart with people, and I've been very forthcoming about even my own hubris and how that caught me. And I went to a reception and contracted COVID and gave it to not one, but two of my daughters. So nobody's immune. And this is not the time to be shamed or blamed and all that, because there are things that we can do. And I like Art, I'm saying, do what you can do. And I understand, like I said, I didn't get vaccinated, skipping my way down to the clinic to get the shot in the arm. I was very hesitant, but I took that hesitancy with me when I got them shots, and I don't regret it because I'm still among the living. And so is the family, even the family that I infected. God, praise God, we recovered. So, do what you can to protect yourself. Get the vaccine, get your booster, wear your mask, to deal with your other health too. We talk a lot about COVID, and I think this is like the sort of snake that's right in front of us, but we still got hypertension, diabetes, cardiovascular disease, the stress, mental health, all these other things, and problems that were in our community, cancer, before this pandemic, and those things have not gone away. So I just encourage people, take the reins of your own health during this season.
And Doc, they asked that you come back. So, Doc knows she can come back anytime because I enjoy this. And I still have a lot of questions, and y'all see I keep on.
Look,
y'all
I'm
see I keep on looking down.
In Baltimore. I'm in Baltimore. Look at the baby's crib. I'm tucked over in the corner. I tried to find a little tight spot, but I'm surrounded by it's baby stuff everywhere. I'm in a baby's room.
It's all good. It's all good.
But I'll come back. I promise I'll come back.
And I thank you. I thank you so much because this is something serious and something that needs to be discussed. And I thank you for taking the time to come on and enlighten the people and myself. And, it was a great conversation, and this conversation needs to be had. So I thank you so much, Dr. Furr-Holden.
All right. Thanks for having me, Art. I'll come back anytime.
All right. Love you, Facebook. I really appreciate you. It's time to eat now. And I'll talk to y'all later. Thanks, Facebook. Love you.